So good afternoon. My name is Eric Feldman from FIU in Washington, D.C. I'm joined by my colleague, Kerrie Montgomery, Director of Campus Life, and we are hosting a dialogue and information session today on the future of equity, health, and beyond. I will introduce our esteemed guest speaker in just a moment. If this is your first time attending an event with FIU in DC, a little bit about us. We are based here in the nation's capital and have a few different lines of work that all align with enhancing student success and FIU's federal priorities here. So our solutions line of work is working directly with congressional offices and federal agencies on funding and partnership for a variety of research initiatives, including on health disparities. So this event is very much tied into to that. Idea exchange programming is convening key stakeholders, not just from FIU, but throughout think tanks and research and advocacy organizations, positioning FIU as a leader of dialogue and ideas into the external world here in DC. And Talent Lab is what you're experiencing today. Talent Lab is our robust set of programs for students and alumni for internship and career success in Washington, DC. The fly-in that you'll be learning about today is part of that. And programs like this where you get to learn about interesting topics from a policy angle are all part of the Talent Lab. So we are glad that you are here. Today's the beginning portion of this session. We are going to have our guest speaker, Yolangel Hernandez Suarez, MD. She's FIU's Vice Provost for Population Health and Wellbeing. And Dr. Hernandez Suarez, in addition to her MD, holds a MBA with a specialization in health administration and policy from the University of Miami. She has spent her career in South Florida building partnerships among hospitals, community, academia, and government to advance learning and health. Born and raised in New York City, she attended Swarthmore College and the Johns Hopkins University School of Medicine, where she trained in obstetrics and gynecology at the University of Iowa Hospital. She spent several years on the faculty at UM's Miller School of Medicine and in private practice in Miami Beach. She was the Vice President and Chief Administrative Officer in the Jackson Health System, where she had oversight of ambulatory services, specialty care, diagnostics, and mobile health. From 2010 through 15, she served as the Associate Dean for Graduate Medical Education here at FIU's Herbert Wertheim College of Medicine and CEO for FIU Health. Dr. Hernandez Suarez was subsequently Vice President and Chief Medical Officer for Humana's Care Delivery Organization and VP of Clinical Innovation for Conviva Care Services, a managed services organization. Her current role is in the College of Medicine, in addition to her Vice Provost role, is as Associate Dean for Clinical and Community Affairs. So not a better person that we could possibly be talking about the topic of health equity today.
Oh, cool.
I'm going to paste some documents in the chat as Dr. Hernandez Suarez gets going with her opening remarks. First is a list of ways that FIU has been involved with health disparities efforts, specifically as it relates to the COVID-19 pandemic. Some of them on your screen here, that various researchers at the university have developed regional trackers for trends of the of COVID, methods for reducing the spread by understanding how people's memories influences contact tracing and where we've all been, how individuals are influenced online, telemedicine, which is a big deal for access, and helping make sure the frontline workers are healthy and nutritious with their diets while they are working overtime to support us all. And she'll also be talking about the Okanagan Charter, which is a document that kind of frames her current Vice Provost role. Wanted to mention those, going to paste those into the chat. So with that, we'll talk about our fly-in a little bit later. But Dr. Hernandez Suarez, I know you had some thoughts on this topic of how the COVID pandemic might hopefully advance positively, some of the moves towards health equity, and also how that intersects with other social issues. We'd love to hear your opening thoughts on that now. And I'll tell people to please feel free to introduce yourselves in the chat, who you are, what drew you here today. And if you have questions, even before we transition to Q&A, throw some questions in the chat. We'll call on you to ask those via video or combine a few of them together for our guests.
Well, thanks, Eric, and welcome everyone. And in true Miami fashion, I'm having internet issues because it is windy here in my neighborhood. So I apologize if I disappear suddenly. I'm ready to go onto my cell phone if I lose you through my laptop. So I'm so grateful to have the chance to work with FIU in DC. I've stated to my friends Eric and Carlos in the past that I'm a FIU in DC wannabe, and each time I've had the chance to visit and or collaborate, I've learned and gained so much. So I'm really delighted to be asked again to help support the offering in October, which sounds amazing and timely and relevant, and just sounds like a great opportunity. I know that Eric has told you a little bit about me, but I'll share that I come back to FIU now as Vice Provost for Population Health and Wellbeing, which is a new role for FIU. As you heard, I spent the last 5 years of my life inside of Humana, doing population health management for about 250,000 seniors in a full risk Medicare Advantage model. And what I learned in those 5 years is that it stinks to grow old in America. And the social determinants of health, the fabric of society, the burden of chronic illness is really overwhelming. And I think it's a topic that needs more transparency. And clearly, as I get older, I would like it to get better. But what I decided after that stint is that I really wanted to spend, I probably have about 10 good years of energy left. I wanted to do some upstream work, meaning that I wanted to work with younger people and trying to shape people's understanding of their own health, their need for self-advocacy for their health and their health literacy. And what better place to do that at FIU. So that's how I've been here since last summer. I will say I did not have coronavirus on my list of things, but it has shaped what I am doing right now, as you can imagine. I came here to sort of rebuild the house, but if the house is on fire, we got to address the fire in the house before we can talk about how we rebuild the house. So, and frankly, and letting no good crisis go to waste, we're starting to use the platform of coronavirus to make our very urgent platform about the need for health literacy amongst Americans and the need for average Americans, certainly anyone graduating from any university, to understand their participation in their own health journey and the health journeys of others, and frankly, in whatever profession they decide to undertake, how they can promote health as we take a very holistic view of health. So picture a world where coronavirus has hit, but where people have a basic understanding of things like, how germs work and how we protect ourselves from germs, and the meaning of the word quarantine or the meaning of the word contact tracing. I have to tell you, this has absolutely, like everything else, coronavirus has shined a light on the very fragile state of American and certainly Miami-Dade County's understanding of their own health and how they need to respond and act to protect themselves in the setting of infection. I'm an old New Yorker, but came from parents who were Cuban refugees in the early 60s. And I got to tell you, this is a place where we could sure use some developing world skills. People in the developing world have a much higher understanding of how public health protects them and an understanding of how infection and basic public health measures go together. So really, we were really flat-footed in this. We have had several decades in our country where healthcare really has been management of acute illness and management of chronic illness, and with very little understanding of health promotion or health literacy. So we have a chance to make a difference, and our organizations such as ours, we're a big impact organization. You think about the anchor institutions in South Florida, I would put FIU in that bucket. And I'm an old healthcare administrator. I see FIU as having more impact on health for the long term than I do our hospital systems, for example. Why do I think that? Every semester, FIU puts 15,000 people into community. We have almost 300,000 alumni right now. What those people do and how they take care of themselves. Do you guys hear me now?
Yes.
Okay, so I'm gonna stay on video, but if I disappear and show my avatar, it's just because I don't have enough bandwidth. So I don't know where you lost me, but I was making a plea as FIU is an anchor institution for health, meaning that 70,000 people in the FIU community exist together, and every year we graduate 15,000 people into community. They go into all kinds of jobs in South Florida. They tend to stick around. They become our teachers. They become our civic leaders. They become our lawyers and our doctors, our nurses, the fabric of our very society. So picture a future in the not too distant future, I hope, where all of the students, I'm gonna come off here. Where all of those students become ambassadors for health and health literacy, no matter what they're doing. I think health and understanding of health is a human right. It's up there with other things that we think are human rights as Americans. I think it is an emerging value of FIU. And so think about it. We have a chance to be change agents. FIU went through this extraordinary process of being credentialed as an Ashoka Changemaker institution. Ashoka is a set of skills that allows us to be better at social entrepreneurship, to understand how to make differences in the world by what we do, to do well by doing good. And health is a big sector in which we can play with our Ashoka skills. And we will see the value of our work because, again, we're this ecosystem. We're not a university where people swoop in from all over the country, although that happens, and frankly, all over the planet, they come in. But the vast majority of us live in community, work in community, and give back to community with the efforts of our careers. And so this is this beautiful, virtuous cycle that we have a chance to participate in. I would tell you that the United States is starting to think differently about higher education and its role in healthcare. So in Europe, Canada, Spanish-speaking countries in Central South America, there are charters about how higher ed is utilized and leveraged for health and health promotion. So if you go to college in Germany, for example, or in British Columbia, or in Argentina, you don't leave higher education and acquire a degree without a basic understanding of how health works and healthcare systems work. America has not, and we can talk about all kinds of reasons why it hasn't as we develop our portfolio for October. But one of the things that is happening is that is shifting. As our GDP stops us from increasingly eating the sector of healthcare expenditure, right? We can't become 100% expenditure of our GDP in healthcare. We're gonna actually have to do the work of not getting sick. And that requires a very different set of skills, part of which can be acquired in K through 12, part of which should be acquired in higher ed, and part of which should continue to be promoted through occupational health and employment interventions, right? So we're actually sitting at the table with other universities right now, like-minded sisters who are looking at how higher ed can be a lever for health and health literacy and health promotion. We're looking specifically at a charter called the Okanagan Charter. This was developed by our sister schools in Canada. And we believe that it is probably the most akin to what we want to do in the US. I know that Eric will make that available to this group. It is a very inspirational document. And again, I ask you, as you think about it, think about what our response to coronavirus would be right now if we had actually done some of this work a few years ago. I know we would be in a better place. So as far as pitching for the next virtual fly-in in October, I can tell you, having been a participant, these guys and gals put on an extraordinarily well-run, relevant, and career-changing opportunity. I will tell you personally that I think these immersion experiences matter. I shared with Eric and Carlos, I was a biochemistry major at Swarthmore in the 80s, and I thought I was going to be a PhD and work as a chemist. And I had the opportunity to have an internship with a woman who was an MD PhD at that time. Swarthmore was putting women with other women who they thought would, so that we could see how their careers were going. And this woman happened to be an MD PhD, so she ran a lab, but she also took care of patients clinically. For the docs if there are any docs or pre-meds on the call, her name is Babette Wexler, and she is the mother of prostaglandin, a specific type of endocrinology, and really an extraordinary woman. And after we spent a week together, we liked each other. She invited me back to her lab so that it allowed me to have summer experiences with her and put that in my CV for my, what I thought was going to be a career. But after a while, she took me aside and she said, "You sure talk a lot and you seem to like people. You should be a doctor." And so I had no doctors in my family, no path that I could do. And frankly, you know, I was not a trust fund kid. I knew that my college education had to pay my way through life. And so my parents, with all that they could, said, "You better be a chemistry major because that seems to pay the bills," right? So they did their best to give me the best counseling they could. But frankly, I owe my career in medicine to Babette Wexler, to Dr. Babette Wexler, who took me aside and said, "Listen, we think you would thrive in this other environment." And so I tell you, I think these things make a difference, because I don't think I'd be here talking with you today. So I'll stick around for this whole event. I will be part of the event in October. And so I think totally worth your while, and happy to answer any questions, at least from my end, about how content is being built. I'm excited about the time in October. I know that the people, Eric and his team, will make it worthwhile. You don't fear the fact that it's virtual. Everything we're doing now is virtual. So don't dismiss the opportunity. You will still be connected to players in DC that matter to you. Frankly, they're doing their business by Zoom as well. And so I would not hesitate to recommend this to any of you, regardless of whether you're pre-health. My challenge to Eric and Carlos was to say, look, I think health is everybody's problem. So I'd like to see these students connected to unlikely players for health equity, the Department of Transportation, the SNAP people, the agencies I haven't even thought of yet, because I think that we would love to see our students provocatively engage with these agents about health and what they're doing to make a difference in the health of the people that they control through policy. So I'll be quiet now, and I'll cede the time back to you, Eric. I'll stay on and be available for questions.
Awesome. Thank you so much for your comments. I'd love to extend this discussion with you for a few more minutes before transitioning to the nitty-gritty of the fly-in. So we already see one of our colleagues, Florence Greer from the Temple College, asking a question. Florence, did you want to come on video to ask that question? Or audio?
Sure. Hi, Dr. Yogi. Good to see you.
I'm so glad to see you.
Yes, great. Hello, everyone. I'm Florence Greer with Temple College of Public Health and Social Work, the practicum coordinator and instructor for 2 of our courses. So Dr. Yogi, as I affectionately call you, have known you for years. do you foresee a national strategy for COVID-19?
Florence, I will tell you that I do not at this time. I do see almost an increase in federalism right now with the different states, and almost a sense that even within states, the response is regionalized. Some of that makes sense because the virus hasn't hit us all at the same time and in the same way, so we understand. Part of what has been challenging for us, though, is that we would have liked to have seen some hard guidelines based for testing, for contact tracing, for the public health measures that that are critical to the success of any infectious disease. So I unfortunately, I will quote Lily Tomlin when I say, just remember, we're all in this alone. So we as an organization, FIU, I think has rallied by putting certain investments in place, and obviously as we slowly come back together for in-face learning and work, those mitigation efforts are being tested, right? So we have our pre-screener, right? The thing, am I healthy enough to come on campus and do work and with others? So that's that P3 app. So then obviously once you are on one of our campuses or one of our sites, the idea is that you must do public health measures, mask, distancing, hand washing. And you'll see if and when people come back to campus, there's been a lot of change in our physical environment as far as, seating being taken out so that we can meet physical distancing, plexiglass, sanitizer in all kinds of places. And finally, we've put together the COVID response team, and that is the team that I lead through the Office of Population Health and Wellbeing. Extraordinary group of young public health professionals, many of whom have trained here at our own FIU. A beautiful story about people who've come back to serve in this capacity during this crisis for our FIU. And they are serving as resources to the faculty, staff, students who test positive, and also helping us understand how we should quarantine to decrease risk while for potential exposures. So more to come as we test those systems. They've been tested primarily on our housing students as they've come back, on the essential personnel, including some faculty that have been on campus throughout the whole summer, because we have had to keep certain things going, as you know, in research, et cetera. But we're doing our best, and we're trying hard to listen to the CDC. My taxes pay for the CDC, your taxes pay for the CDC. So we would like to get the guidance that we need from their brains. But I also think that we are seeing some of the results of the marginalization of science, right, in our community. And so how do we continue to promote the value of our voices as subject matter experts at the table making policy? And I think that that's something that the students need to witness and also learn some techniques for the advocacy of being ambassadors and endorsers of science, especially in the setting of uncertainty.
Thank you.
Quinn Nesbitt and Destiny Pearson have both put some questions in the chat. If you two want to come on audio or video one after another and ask those questions, Dr. Yogi can address them one after another.
Okay. Hi, my name is Quinn Nesbitt. I'm a dietetics major at Temple College. And my question to you, which I'm now kind of tweaking just a bit, how can FIU strengthen their relationship with marginalized communities within Miami? You did say that you come from a background where, your schooling wasn't paid for. So how do you see FIU reaching out to those communities when health resources were already scarce?
I love that. And obviously our impact, we want our impact to to go outside of our walls. Now, in some cases, because we are a commuter school, our students go in and out of our community, the FIU community, back out to community, right? So how do we help them? For example, we have many students living right now in multi-generational homes. We worry about how they may or may not just multi-generational homes, but homes with people working as essential workers, right? So that's part of our ecosystem of risk. So how do we help educate, give people the skills and tools that they need to understand how they can do their best in a very infectious, with a very infectious agent. We're learning every day how sticky this is. Florence and I have lived through a couple of these, through hepatitis C, through HIV. We came to understand those viruses as having pretty specific ways in which that they infect other people that you could manage through behaviors, but no one can stop breathing, right? So if this is a respiratory ailment that is passed through breath, it is extraordinarily infectious. And so that's part of what we see. The other thing I think is some intent, right? So what do I mean by intent? So right now the NIH is putting out money for discovery around coronavirus. Part of what we've done, and that's through STEMPL, is we've already collaborated with Dr. Baum and Dr. Palacios. They have put out grant proposals to work specifically with marginalized people to see how they are accessing testing. And we're very hopeful that those grants get passed. One is specifically looking at people with severe mental illness, and we know that those people get the rough end of any kind of health care. And then the other looking specifically at people with HIV. How are they accessing, because this is just one more thing, right? So that is the type of intent. So think about, wouldn't it be great if health and health equity was just a value through which FIU looked at every opportunity, right? So right now, our lens is student success. And we have other values that the social entrepreneurship, the engagement in a global world. But my hope is that through this work, and through advocacy of students like you, we eventually say, hey, you know what? FIU wakes up every day and has health and health equity in that lens of things that they look at every opportunity, because I see that opportunity everywhere. So I hope that answers your question. It's a journey, but it won't happen without intent.
Right. Thank you so much.
Sure.
As a supplement to that, because health disparities is both a research priority and a federal relations priority for FIU, the link from at the beginning of the chat about some specific COVID-related research projects and community engagements FIU is doing, as well as the page from our federal relations site on our overall health disparities work. So those things are useful to everyone, and that's why we're doing this whole fly-in too. So
Yeah,
hope to see some of those asking great questions in this program to apply to that. Destiny?
Hi, I'm interested in knowing how COVID is going to change our health systems, or how they're changing it right now, assuming that like in this foreseeable future, we'll have a widely accessible vaccine.
Destiny, I think that's a really good question, and it keeps me up at night, right? So I'm an old hospital administrator. I've worked in the insurance side of the health system. I'm OBGYN and taking care of lots of women, throughout their lives. And I have a couple of concerns. Part of my concern is that we don't know everything yet about this virus. And again, I go back to how we lived through HIV in the 80s, right? So it seemed like every week HIV did something else, right? You're like, what do you mean it causes dementia? What do you mean it causes cancer? What do you mean it causes neurologic issues? So I think we don't know yet everything about this virus. We are concerned about some of the emerging, not yet understood consequences that we're seeing even after people recover. We are seeing people with blood clots, people with heart attacks, very small numbers still, but we are starting to get some concern about what might be unexpected consequences after recovery as we learn more about the virus. When we first started to thought we understood the virus, we thought it was a respiratory problem because it is transmitted through respiration, right? But the issue is it does not appear to just impact the lungs. We're learning every day that the virus seems to make lots of blood clots everywhere. It causes a type of hypercoagulation state in people. Those blood clots can be very tiny and they don't show up. But later on, we might see damage to organs like the heart, damage to kidneys. We all watched the poor guy, I don't know if you, the Broadway star who had a horrible course with this and had his legs amputated and eventually lost his life. That in those early cases, we started to see that this is not exactly what we thought it was. So let me go back to polio, which is a long time ago, but in the last century, there was a generation of Americans that were impacted by polio. And we could see what polio did because it caused stuff on the outside, right? You had a limb that was damaged and that caused weakness and difficulty with mobility. The problem with COVID is that we don't really see what it does. And so we are, that is the importance of longitudinal studies, and Florence and other lifelong researchers understand how to explain this better than I do, but we must start to follow in a disciplined and scientific way an understanding of what this virus is doing to people. Now, from the economics of it, I'll put my health, economics hat on and tell you that all of the hospital systems are suffering terribly now. Why? Because our hospitals make money off of, they don't make any money, they don't make money off of COVID, and their resources are being used up, and they are not seeing any of the usual and customary things that helps them pay the bills. Hip replacements, heart attacks. People are staying home. We are very worried from a public health perspective, the burden of illness that is going to start to come out because people have been staying away from hospitals. What is out there? Undiagnosed cancers, undiagnosed mental health, undiagnosed neurologic disorders. I think we are in for a very challenging couple of years. All the more reason for your generation of learners to engage in this. There's going to be work and discovery for everyone in every sector available around coronavirus. And so, I encourage you to think about how this will play a part in your decisions about what you study and decisions about how you're going to spend your career.
Thank you.
Sure.
Yeah, thanks. It looks like we have one last question that just came in before we transition to our information session on some similar themes, but specific to how the FIU's students in these fields can be advocates. Ina, would you like to ask that question?
Hi, everyone. Good afternoon. Yeah, I guess my question is more so, how can we as pre-health and pre-professional students help advocate for underserved communities? And what important steps should we take now to better impact our future work?
So that's a great question. And I think you will learn, you'll get the part of the tool set that you need if you have the opportunity to participate in this 3-day event, because I think a lot of what is being structured for that curriculum will answer that question. I would say in the very short term, though, we need young people to help be influencers in their families and amongst their peers for the public health safety measures around coronavirus, right? So we have to survive this as a society. We have to understand how we can keep each other as safe as we can. Young people, I am trying really hard not to fall into the profiling of young people as being these, party animal, devil may care people who are out there spreading disease. And you'll hear those stories, right? Help be a different model and bust those stories. I know that your generation is extraordinary in its ability to care about others, to exhibit empathy, to be giving. How do we reshape those public health measures to be exemplary of what young people are capable of? We saw that, we don't have to go far. We saw that when we had the shooting in Parkland, right? We see it now as young people come into the street to talk about racial inequity and systemic racism. Health and health equity need to be a part of that story. And it's not gonna, Florence and I are gonna fight to the end, right, Florence? But this has to now be a young people battle, because the energy is with you and the numbers are with you. And so I love that pre-health professionals and any pre-professional would engage with this and specifically understand around coronavirus how you can bust myths, how you can tell a good story, and show up as an example of what we should be doing in community, in your home, and amongst your peers.
May I add something, Dr. Yogi?
Absolutely.
For everyone, please educate yourself so that you can communicate what the topics are, what the facts are. Start at home, start with your own group of friends, and reach out to your elected officials and tell them, look, you're concerned about this, because they have a lot of power that's impacting your lives. So first and foremost, educate yourself on the issues so that you can thoughtfully communicate what your concerns are and have a cogent argument, okay?
All of that is a great lead in, thank you all, to what the FIU and DC Fly-In Series is all about. It is in many ways an advocacy training program. So I'm going to turn over to and introduce my colleague, Dr. Kerrie Montgomery, Director of Campus Life, to get us started on what this program is all about.
Thank you, Eric. And thank you to Dr. Hernandez Suarez. That was great. I think that was an excellent setup for us to talk about who this program is for. And I think that there are a lot of pre-health professionals and master's students on the call today. But I think that you've shined a light on the fact that this is really everybody's work. And so I appreciate that, and even that reframe for myself. So the DC Fly-In is a partnership between the Department of Campus Life and our FIU and DC office. I am new to working with this program, having transitioned from a role over at BBC. So I've been really enjoying working with Eric and Carlos in the DC office and getting this program prepared for the fall. Obviously, we were looking forward to being together in DC, but we are excited to be able to do this virtually. So the elements that make the DC Fly-In great are still going to be part of this program. And the Fly-Ins are a 3-day experiential seminar. We focus on a particular topic each time. And so when we started talking about this year in October's program, we were thinking about, the topics of the day. Obviously, we are in an election year, and how that is going to impact pretty much everything, all the different policy issues that are in play during an election year, before and during and after that process. And then we couldn't ignore the fact that we are in this pandemic situation. And so it was a perfect combination of things to come up with the topic for this year. So I thank our colleagues in DC for putting together what's going to be a great program. So 3-day experiential seminars where we focus on the policy issue and really are thinking about what career and internship opportunities exist in the DC area. We want you to take away from this program a lot of great experience and knowledge, but also contacts for potentially getting some internship opportunities or job opportunities with the folks that you're connecting with during this time. We, program different sections, different seminars, different meetings with these thought leaders and folks from different nonprofits, government agencies, and so forth, to give you an opportunity to have engaging conversations with these experts across many different disciplines and try to provide really all the different, I don't want to say the different sides of things because there's always more than two sides, right? So we try and bring in different perspectives, a variety of different perspectives so that you're able to get a really balanced experience. And the future of FIU, the Future of Fly-In series, which is the partnership specifically with our two departments, because there are a variety of other fly-ins. I know Eric and Carlos and the team up there are on fly-in overload throughout the year, but our programs focus on a specific topic that is at the intersection of the research strengths of the university and the federal priorities that are, of the day. And so we have the national dialogue and a policy hack. Every program ends with some kind of a hackathon where you're given a topic and a period of time to work in small teams to try and come up with some solutions, real world solutions, and present those to your colleagues and to some of our experts who join us for those opportunities. So it really is a very comprehensive program. It gives you a lot of opportunity to meet and connect with folks and to get some hands-on experience thinking through policy once you've had those opportunities to get some information.
There's some cool picture here on the right from the most recent in-person fly-in of the policy hack going on, where we can see it's not just about absorbing content, but coming up with solutions. So as Dr. Montgomery said, everything that we normally do in person is scheduled to happen virtually. We actually did do a virtual fly-in at the beginning of this summer that I participated in, so I can tell you with full certainty it is an amazing experience to do online. What this looks like is Zoom-based panels and other interactions. Other interactions could include an advocacy visit with staffers from congressional offices where we can ask for solutions or for certain legislation to advance or to share what proposals were developed during the policy hack session. Just like in a in-person fly-in, full participation over the 3 days is required. In a in-person fly-in, Campus Life does offer a letter that can be shared with professors if a certain class would have to be missed during an in-person fly-in, because being in Washington physically, it would be difficult to make it to class. So we could do the same thing with a virtual one, but you should have the ability to be available over the 3-day period, which will provide the dates in order to do this, because it all interacts with each other and builds off of one another. So developing that policy proposal is contingent upon having heard from the federal agency officials about how they decide policies and from think tank researchers about policy recommendations, for example. There are opportunities for group reflection and teamwork, the teamwork being policy hack. There's also a cool picture on the previous slide of all the students getting to meet each other in person. So we make sure that in the middle and end of these, you get to not only hear from all the experts and alumni that we bring you, but all of the other students who are participating. Because as you can tell from this event alone, those of you who are find yourself coming to an event like this and then applying to our fly-in have very common interests. And the connections that you make among yourselves as students can lead to some of the most impactful work. Jobs and internships are a focus, so we ask each of our panelists or guests during the fly-in to share information about internships available at their organizations, and myself and my DC team will be constantly sharing internship opportunities that are available while you're engaging with us and afterwards, because we actually had an in-person health-oriented fly-in about 1.5 years ago, and constantly still, I think last week was the last time I sent an email to our health fly-in alumni group with a health-oriented internship. So you can expect to hear from me about opportunities far after these 3 days as well. Even exposure to local history and culture. A DC fly-in is about the topic. It's also about getting to know our city. There are virtual tours of museums. There are virtual concerts of go-go music, which is culturally very important to DC. There are opportunities to watch videos or read about the history of Washington, DC and how it became our capital. All of those things are interspersed throughout the experience and shared in emails leading up to the event as well. So it's really robust experience and something exciting here. You might have seen some images like the one in the top left shared by colleagues or even professors on LinkedIn. FIU is now offering digital badges for a variety of experiences. So you not only have the experience, but you're able to show that you had that experience and develop skills from that experience through a digital badge. This is an option for people who are accepted to the fly-in. If you participate in several reflective assignments on top of the core required components of the fly-in, you can earn the DC Advocacy, Communications, and Careers digital badge. That badge gets assigned directly to you, and you can share that on your LinkedIn. And if someone clicks on your badge, it verifies that it was assigned to you in your name, what skills you earned during the experience, and when and how you earn that badge. One more note on the national dialogue element as well, because most of what you will experience in the fly-in is the participants of the fly-in. The national dialogue element also is an event open to the public where congressional staffers and federal agency officials and think tank researchers are invited to an event that we host. And they're not just panelists like most of the sessions, but participants along with you. And so very robust experience there. We talked a lot about the topic already. And this picture here is actually from one of those national dialogues in person, where this was a full, large event with many participants on a previous health topic. So it'll be a virtual version of that. I think by this point you have a pretty good understanding of what we'd be focusing on topic-wise. The entire 3 days would be focused on how the COVID-19 pandemic might accelerate the race to close critical disparities at the intersections of things like health, economic, and mobility and education. And those intersections are where it is very important. Dr. Hernandez Suarez made an interesting reference earlier to how might a Department of Transportation play a role in health equity, and we will really be exploring that theme that she brought up of why health is everyone's responsibility. And we will not be shying away from the role and significance of the historic 2020 election. There will be analysis of how everything what we are talking about could be impacted depending on the outcome of the election, and beyond the two sets of candidates running now. The goal will be to understand how the federal government works, how a transition of presidents not only affects the White House, but the leadership of federal agencies and new policies. So you'll see that. And when you see the dates of the fly-in, you'll see a unique opportunity to hopefully engage in this session both before and after the 2020 election.
Okay, so just to share a little bit about the timeline for the program. So applications are actually open as of today. So we will share the information for that. On the last slide, there's a link to the DC fly-in website, and the application link is available there. It's a Go link, so you can access it that way. It will close at midnight on September 13th, and that's a hard deadline, so we won't be able to accept applications after that point. And we will begin our review of the applications during the week of September 14th, and we'll be reaching out to applicants during that week to schedule you for a group interview. We just do a group selection interview where we'll convene, groups of 10, 12, it depends on how many applicants we have. We try and get together a nice sized group to have some dialogue, and that's part of our selection process. So those will be scheduled for the week of September 21st. So kind of keep that in the back of your mind. And then the week of September 28th, we will let folks know if they've been selected to participate in the virtual fly-in. I would ask you to kind of softly save the date, pencil in the weeks of October 5th, 12th, and 19th. We do have, as part of the program, 3 required workshops that are prior to, and this is also what we do when we're actually physically going to DC. We have some pre-fly-in workshops, and so we're going to focus on advocacy, communication, and career internship preparation. We want you to be well prepared with an understanding of how all these pieces work. We don't take for granted that everybody who's applying to the program maybe understands some of the intricacies and nuances of advocacy work, or we want you to be prepared to communicate well with the folks who are representing government agencies or congressional staffers or whoever you might be speaking with. And then we also want to get you ready in terms of career and internship preparation, some resume review, and things of that sort. So we do those 1 program per week, and we will set a schedule. We'll try to make that consistent so that it's, in the past, we've done them on Wednesday evenings. So you would have 3 Wednesday evenings in a row. It's usually about a 2-hour workshop. So we'll send more information about that. We'll try and get those solidified as quickly as possible, but those are required element of the program. And then the program itself is going to be over the course of 3 days, as the fly-in would be. But because of the election, we had a really nice opportunity to split it up a little bit. So we'll do 2 days of the program prior to the election, and then the final day will be a few days after the election. We spaced that out a little bit so that we could give a little bit of flexibility for results. We know that this is going to be an interesting election year, and with some of the complexities of absentee ballots, mail-in ballots, that kind of thing, that it may be a day or 2 before we have a final result for the election. So we wanted to be thoughtful about that in scheduling the final day. But whether we have final result by the 6th or not, it's still a good opportunity to have interesting conversation about how that impacts the topic at hand. So those are full days that you would be participating in. And then the requirements for the application are pretty simple. The program is open to all FIU students at all levels, undergraduate, graduate students, professional students. You need to have a passion for the specific theme, but you do not need to be in a program that's related. So to the conversation that we were just having, political science, history, English, it doesn't really matter what your major is. If you have a passion for this specific theme and are interested in learning more and being engaged more in the topic. You do need a 3.0 GPA. We ask that you be enrolled in a minimum of 9 credit hours. We can be flexible with graduate students on the credit hour enrollment. That's 9 credit hours for undergraduates. And then you do need to be in good standing with the conduct office, the Office of Student Conduct and Academic Integrity. So the application elements, you'll find that it's a Qualtrics form, and you'll be asked to share a bit about why you're interested. We will ask you to upload a current resume. And then there are opportunities to share some relevant organizations that you would like to virtually visit. If we were going to DC, that helps to sort of curate the experience of some of the departments that we might go to or offices we might visit, and that will still be the case for the virtual program. And then we'd like you to share a little bit about your DC internship or career plans. And then we ask you to provide a link to an article that you have found addressing the topic at hand's impact on South Florida or other relevant communities. So really, we want to see that you have a passion for the area. We want to see that you have done a little bit of research and can tell us why you think that this is an important topic, and share with us something interesting that you found about it. I did just see a question come in. What if you do not have a GPA yet in your program? If you're brand new in your program, if you're in a master's program, we would look at your undergraduate GPA, your final undergraduate cumulative GPA. If you're a first-year student, then we would look at your high school GPA. So don't be worried about applying. Please, if you're interested, apply, and we can work all of that out with you.
Yeah, definitely. Passion for the topic is the most important requirement there, I would say. So I have pasted in the chat a link to the article recap of our previous virtual fly-ins. You get an idea of what it's like to do one of these online. I am pasting in the chat now the actual link to apply, which is very straightforward link. This is a fly-in. You can go to flyin.fiu.edu. That page has a lot of other information about the fly-in series and other upcoming fly-ins, as well as a link to apply to this one via Qualtrics. I am shamelessly promoting here an upcoming FIU in DC event. If you enjoyed this event, we have much more going on this semester, and in a few weeks, we have a great panel about the importance of communications in advocacy with 3 individuals who do communications campaigns for a living. I pasted that in the chat as well, so we hope to see you there. It looks like there are some other questions coming in, so Dr. Montgomery and I will address those, and both of our pieces of contact information are here on this slide. And in addition to the fact that the virtual experience is an incredible one, we also want to emphasize that once you're part of our family virtually and do one of our virtual programs, you would be VIP for us getting you up to DC in person in the future when it is a good time for you to do so. So there are a lot of virtual internships right now that you could even get immediately, but doing this program, we could work with you on in-person internships in the spring and beyond if conditions remain appropriate to do so, and also careers if you're graduating soon. Okay. So
yeah, and I just want to tag on to that because I saw one of the questions was if you have fewer than 9 credit hours. Yes, if you're in your final semester, then make sure that you apply for graduation. You have to do that in PantherSoft. But also, yes, we will definitely, again, we'll work with you on that. That's not a problem. But I definitely encourage folks who are in that last semester, if you're interested in careers in the DC area, this is the perfect time to apply for this program.
All right. It looks like, Kerrie, you've done a great job addressing these questions in the chat. So I think we've tackled credit hours. We have tackled that there are no specific character word limits for the essays. So if there are any other questions, we'd be glad to hear them via the chat or even people coming on to the video and asking us.
Well, thank you all so much for joining us today. We're happy to be able to bring you some great content. Thank you again to Dr. Hernandez Suarez for your time, and also to Dr. Greer. We appreciate you sharing some good comments too. But thank you all so much for coming. If you have questions, please do feel free to reach out to us by email. We look forward to seeing lots of applications.
Great, thank you all.
Have a good day, everybody. Stay safe.
Be well.